Evidence supports that beta cells can be stressed to the point of extinction. Dr. Sisho from Keio University School of Medicine in Japan has proposed the beta cell workload hypothesis, which postulates that when beta cells are overworked, they're damaged or become dysfunctional. However, if the stress is removed, some function can be regained. For example, we know that when those with newly diagnosed type 1 diabetes first start insulin therapy, they very often have what we call a honeymoon period. As the beta cells are being destroyed by an autoimmune process, the remaining functioning beta cells are overworked in an attempt to produce enough insulin to keep blood sugars under control. But once we start treatment with insulin, about 60% of the time, the person with type 1 diabetes suddenly needs much less and perhaps no insulin at all for a short period of time. This can range anywhere from weeks to months. And the thought is that the beta cell rest allows the remaining beta cells to be more productive for this period. The Diabetes Prevention Program outcomes study looked at participants diagnosed with prediabetes that had completed the diabetes prevention program. They found that participants that were able to get their fasting glucose below 100 or a 2-hour glucose tolerance test below 140 at least once during the DPP actually had a 56% decreased risk of developing type diabetes compared to those that never achieved normal glucose readings. And this was regardless of intensive lifestyle changes. The diabetes prevention outcome study also showed that normalizing glucose, even for a short period upon follow-up, progressed more slowly to developing type 2 diabetes at the rate of 5% compared to 11% over 3 years by those who never attained normal glucose regulation.